Today I'm going to talk about child loss because someone in our Facebook community group posted about child loss, and this is something that I went through in my life, and it's such an incredibly complex type of grieving process that I wanted to make a video to hold space and to bring up this discussion. So the first thing I wanted to do was to define child loss. What is child loss? And in reality, child loss includes a miscarriage. It includes choosing to have an abortion. People live with the loss and the grief of that their whole lives. Child loss includes losing a child during pregnancy, so a stillborn or a miscarriage. It also includes losing a toddler or a child, a teenager, an adult, someone in their 50s or 60s that's still losing a child. And so all of those types of child losses are valid and are deeply, deeply painful and have their own unique healing process. What are 3 myths about child loss, and what are 3 truths that we can walk away with, and how can we move forward? And so the 3 myths, number 1 was that losing a child does not affect your body, and that's the furthest from the truth. Yes, it does. We can wake up with nightmares after losing a child. We can wake up with anxiety and heart palpitations and triggers that affect us throughout the day. Yes, it does affect the body. It affects the nervous system. It physically affects us when we lose a child. Number 2 myth is that people will say, oh, well, don't worry, you'll have another child. And that is the furthest from the truth. We cannot replace people. We can, heal in different ways. We can have different children sometimes if we're still in the childbearing phase of our life. But when somebody says, oh, that's fine, you'll have another baby or you'll have another child, that's the furthest thing from the truth. We cannot replace a child that we lost. And as a parent, we know that. Another myth is that time heals all wounds, and that's not true. When we go through our lives, whether we lose a child in our 20s or 30s or 40s or whatever age we lose a child, the passage of time does not suddenly heal and we're like, oh, that's totally fine. I'm fine now. 5 years passed or 10 years passed, totally fine. It's a very deeply painful experience, and it doesn't just disappear. It's something we learn how to live with. And healing is not a time factor. It's actively working on this grieving process and working with our body and working with ourselves on an emotional, spiritual, and psychological level so that we can live a full and beautiful and satisfying life. So it's an active process. It's not that time will heal all wounds. And now we come to the 3 truths about child loss. And that is, number 1, child loss changes you forever. You will never be the same person before you lose a child and after you lose a child. Number 2 is that because child loss really does affect our body, from the way we eat to the way we sleep to our stress levels and our heart rate and all of the triggers that we live with, it's really important to do body-based therapies and to use the body as a whole in order to help release those continued trauma reactions that come up as we go through the healing process of grieving this child. And number 3, the truth about child loss is we can go through this grieving process and feel the pain, the immense pain of child loss, and also come to a point in our process in our life where we can smile again. And we also acknowledge, yes, I'm living with this loss, but I can laugh again. And I'm living with this loss, but I can dance again. And I'm living with this loss, but I can also joke, and I can also celebrate, and I can also genuinely be present in the moment. We can go through this grieving process and come to a point of healing where we're able to hold both. And so it's not that, I will completely forget about this loss, because that doesn't happen, but our body and our spirit and our mind can learn how to be able to hold both. And who knows how long that will take, and who knows how much work that will take, but healing from this grieving process does happen, and we have the capacity within ourselves to heal and to grow and to still live very beautiful and full lives. To finish off this post, I want to say that I did put together a child loss program for those of us who have lost children in a childbirth setting or in a pregnancy setting, and that was very close to my heart, so you might find that helpful. And on another note, just to walk away with some practical tips, I think it would be very important to do body work and to help to ground ourselves. And whether it's, doing the butterfly hug and bringing us back to the present moment, whether it's doing dance therapy or music therapy or somatic therapies or trauma-informed yoga, anything that can get you back into your body, even if it's just for a tiny micro moment at a time during this grieving process, can be really important for your nervous system to slowly bring you back to outside of yourself and to outside of that grieving process, even though you will come back to that grieving process. I'm sending you lots of love and lots of support, and feel free to comment below for anything that helped you to move through the grieving process of child loss.